of Life. I missed out on them. I was told that they seem to have just joined us. So again, you see the whole radio communication, Vibes Radio, Q95, uh, Voice of Life, and Kyrie FM. And we really, really want to thank the management and staff of those various radio stations because they had to break their normal broadcasting to join with this with us to get this very, very important information out there. We're only going to be there for the next 16, 17 minutes left. Yeah, we depart at 11 o'clock. And we really hope that when we leave, that the information that we would have given you, that you will take it seriously. Our fisher folks, take note of the information because it is very, very likely, as Marshall mentioned, that we might be having some storm surge. How do you call it, Marshall? How do you call it?
Just rough seas.
Rough seas, yes.
Yeah.
Rough seas. I was looking for the proper term, So, so please take note of that. And those of you in low-lying areas, remember the soil is already saturated. The rivers, the ravines, be extremely careful, be extremely cautious as you traverse the country at this point in time, especially tomorrow, Fitzroy.
Yes. Jolly's Pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11:30 a.m. with your hosts, Trudy Kristen, and co-hosts, pharmacists Jacinta Fagan and Leona Jeremiah. Education, information, and a bit of humor. And not forgetting lots of vibes. Jolly's Pharmacy is bringing health and vibes together with Health Vibes. So be sure to tune in each and every Wednesday on Q95 from 10 to 11:30 a.m. Jolly's Pharmacy, leading the way in healthcare.
Good morning, and welcome to another episode of Health Vibes. You must have been wondering whether or not your Health Vibes team would be in this morning, but of course, we had to give way to the simulcast from the Dominica Meteorological Service and the Office of Disaster Management as it relates to Tropical Storm Jerry and the potential indirect impact to Dominica. So we were just waiting and giving way for this critical information to be spread on the airwaves of Q95. But we're here. It is Jolly's Health Vibes. It is Wednesday, a wet Wednesday, but the Health Vibes team is on with you. So if you were waiting for the program and you were wondering and you were anxious and you're saying, boy, where is Jolly's team this morning? We are here and Health Vibes is on. So as I like to say, tell a friend to tell a friend that the program is on. Please share the program. Leona, good morning to you.
Good morning to you, Trudy. It's indeed a wet Wednesday. It's starting off quite windy outside, so I hope that we have all our umbrellas or raincoats, everything that we may need in this weather, and of course, be careful on the roads.
Leona, guess who did not have an umbrella this morning?
Oh, wow.
Me. So I guess as it related to my preparedness, I would have gotten a big F because I left with no umbrella this morning. But yes, to the people out there, just stay aware of right now we've been affected by a tropical wave, not the tropical storm yet, the tropical wave, and it's a rainy Wednesday. There are some wet conditions around the island, so be safe and be aware of that and take your necessary precautions, particularly if you are in areas that that flood easily. You want to take care, but umbrella, Leona, I did not do that this morning.
I, of course, had my Halle Barrage umbrella.
You had your Halle, okay.
Quite covered.
Okay. So Leona was well covered. But we do have a very interesting show planned for you as usual. We have a guest in studio. And so if you're looking at the show live on the Facebook page of Q95 FM or on the YouTube channel of Q95 FM, you already see the guest who is in studio. If you're on radio, you don't know yet. So you can either check out our live streams or you can wait. We're going to introduce our guest and our topic right after these brief messages. We'll be right back.
Introducing Johnny's Pharmacy, brand new website, www.johnny's.gm. It's your time to jump the line. Shop now at johnny's.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Johnny's.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. www.johnny's.gm. Johnny's Pharmacy, leading the way in healthcare. Woke up this morning feeling risky. I had been patients and calling sick, but I end up in Johnny's Pharmacy. And down in the street, Johnny's fix up my immune system. Me feeling fit and strong now. I'm ready to work like it on any mission. If you see me again, Johnny's Pharmacy is number one. Johnny's for you. We cater for everyone. Johnny's for you. The immune system. Johnny's for you. Yo, Dominic is the boy part of box. Whenever I'm in town and I'm feeling down, I head to Johnny's Pharmacy, then boost me up real quick. Johnny's Pharmacy, leading the way in healthcare.
Oh, and if the same convenience make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Shop if you're not a if you're social. It's a to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Shop it's a to everyone. What a happy place. Oh, what a happy place. But just stick some more any item and you automatically qualify for discounts. Check us out at the Mega Store in Fongolle where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
And we are back with you as promised. This morning we have a very interesting topic, an interesting guest who is with us in studio. I do see that our online viewers, our normal Health Vibes crew has been joining and telling us good morning. I'd like to acknowledge Natalie, Simon, who is always on. Coralie, good morning to you. Julie, I see you on as well. So the rest of the Health Vibes crew online, good morning. This morning on the program, we're going to be talking to Nurse Marlene Lambert. She is our guest. She's in studio with us. And she has a very, very interesting area as it relates to health that she's passionate about and brings awareness to, and that is the area of sepsis. Now, Marlene, she said to call her Marlene, will introduce herself to us and get the ball rolling, because a lot of us may really want to know, Marlene, about you and why sepsis awareness is something that you are passionate about as a health professional.
Okay, good morning to Miss Christian.
Good morning.
Good morning. And to the listening public. Some of you may still know me as Marlene Greenaway. So I like to put the Greenaway in, just that people can identify, but it's officially Marlene Lambert.
Okay.
Anyway, yeah. So sepsis is when the body reacts or responds to an infection, an over-exaggerated response to an infection. You must have an infection, and it can cause tissue damage, organ failure, and death. And all that happens so quickly that within 4 to 12 hours, you're gone.
Wow.
And the reason why I'm so passionate about it is because as a registered nurse, I worked in the US at one hospital for 37 years. 32 2 of those years were in the ICU, and in the medical ICU, especially where I finally stayed after floating to the different ICUs, about 90% of our patients come in with a diagnosis of sepsis. I have seen it, I wouldn't say all, but I've seen a lot come in almost dead and walk out. Some came in with just not too bad, got worse, walked out. When I say walked out, meaning being discharged from the ICU, and others they didn't make it. But oftentimes, those who do not make it is because they came in so late, and it's because they had other comorbidities. Then the other reason too is because my father, he died as a result of sepsis at our hospital here in Dominica.
Okay.
August 21st gave him 4 years since he passed away. And I am not saying he shouldn't have died because no one knows, but probably, just probably, if it were diagnosed early and treated promptly, because that's the key to sepsis, an early diagnosis and early intervention, he probably would have stayed another day, another 2 days.
You never
We don't know. And that is the reason why I want to bring awareness. And as a matter of fact, the whole world now, that's the push, to even ask your doctor, do you think I have sepsis? Because oftentimes they're not even thinking of it, because sepsis is not something like a stroke. You come in with the droopy eye, the arm kind of limp and stuff like that. Or if you have a heart attack, you're having chest pain. No, sepsis is not like that. But you have to have an infection, and that infection may cause you to probably have fever or no fever, pain, may have confusion, unable to be aroused, your saturation going down, which you wouldn't be able to know, but sometimes you might find people picking, and it's because their oxygen level is going down. So already, if there is an infection and they have 2 of any other thing, it could be a temperature, say temperature and pain, you're already with sepsis. So when you go to the hospital and you present your case, say, this is what I have it probably 2 or 3 days before, then the doctors should be thinking of sepsis. And the key is to treat you immediately.
Wow.
No one should really die as a result of pure sepsis.
And Nurse Lambert, well, Greenaway, Marlene, but I want people to, the Greenaway part really made a connection for me. So I think it maybe would make a connection for other people as well. But 32 years in the ICU of your 37 years in that particular hospital. How did you, cope with some of the, before I even go into the sepsis aspect, but cope with the severity of, conditions of people in the ICU and losing people in the ICU? I'm always interested about, medical professionals on the front line, particularly in areas where there might be loss. How did you deal with that for 32 years?
Okay. One of the things too, I think if you're not doing a job, just because you're doing a job, it is just because it's part of you. You empathize, you put yourself in the situation and everything. So if a situation arises where someone loses someone, at least you're able to say, it's okay. And you talk with the person. So it's not just the person dies and that's it. You always put yourself in it. So it is not a job. It is, they say it's a calling.
A calling.
Yeah. And another thing with me, I always try not to be burnt out. So I always used other avenues. I go to the gym, I run, I dance, even if I have 2 right foot. I always do things to prevent me from burning. And the most important thing is that I avoided taking what happened at the hospital to my home. Every day I went, it was a new day for me.
And that's a big one, because we notice sometimes that people tend to think that, and sometimes it does happen, if you see something often enough, then you kind of get numb to it.
Yeah.
And the sad part is sometimes when persons get numb to things, then the empathy or the emotion is
Yeah.
lacking.
Mhm.
And so, you have a family who lost someone, and, the ability to be objective also has to have a balance with the ability to be empathetic.
Right.
And sometimes we might lose that. So that's important information that we know, so we can be able to balance how to, help someone who's in pain, but also not to take that pain and, bring it home with you and really dampen you on that basis.
Yes.
Yes, but as we speak to our topic, sepsis, and I got some very interesting pointers there from you already, just in your introduction, and you mentioned that, of course, an infection is the precursor
Yes.
to sepsis. What sort of infections are we speaking about, or what is common that leads to sepsis in your experience? What have you seen?
Okay. So sepsis can be caused by a bacteria,
Okay.
a fungus,
Mm-hmm.
or fungi, we would say,
Mm-hmm.
parasite.
Okay.
Interestingly, walking without shoes could, if you develop leptospirosis.
Mm-hmm.
And since I'm talking about that, even in our Caribbean, he's on. You could look him up. When I attended this summit, he presented as a survivor, a doctor, Dr. James Hospitalis, infection control doctor from Trinidad and Tobago. He developed leptospirosis, and as a result of that, went into septic shock, as a matter of fact. So, and a virus.
A virus. So bacterial infections, fungal, viral, or even parasites.
Yes.
Okay.
And anybody can get it. Anybody. No one is exempt.
Okay.
From a child who was just born
Mhm.
to we have a 180-year-old gentleman.
Mhm.
Yeah. To the oldest person and all in between. No one is exempt from sepsis. And I said it child because if the mother probably has an infection during giving birth, she can pass on the infection to the child.
Okay.
Because if you go on Google, he was 9 weeks or something, so 9 days something, so developed sepsis. And there was something else, your question?
No, I just wanted to know what type of infections could lead to sepsis. You mentioned all the causative agents. I'm wondering if people, think of, okay, if I have a urinary tract infection,
Okay, so that's
if I have
yeah, okay.
what can possibly lead me in that direction?
Okay, so you may have a pneumonia.
Okay.
You don't know you have the pneumonia, but you're feeling a little chilly. You start breathing heavy, then you're not eating.
Okay.
So that will lead you or your family to say, but so-and-so is not looking well today.
Okay.
They might take you to the hospital. And again, that is where sepsis, early diagnosis and intervention come in. When you go there, you say that they should at least do a chest x-ray to see, okay, is it a pneumonia or not a pneumonia? So if it is a pneumonia, then you will be treated promptly, and that can save your life. Now, in the case of a urinary tract infection, you may have burning. No one should have burning when they pass urine normally. So that would alert you, something is a little wrong. Then the urine might turn a little cloudy. Then you know for sure you have an infection. Then again, it going into your system. You might start feeling chilly, you have pain. So again, when you go to doctor, they should do a urine test to see, what is there, why the urine is cloudy and whatever. So any infection, you must have an infection, and that infection will always bring on something different in how you feel,
symptoms.
how you look, and so. Let me just say, for children though, it might be a little difficult because children cannot talk. So you as a parent, you would have to look to see, but how he just, curling up like that, he's just crying, or he's not eating, or some people, they're smart enough to just check, their little pulse racing, or something is just not right with your child. So children, you have to be more observant. Adults can tell you how they feel, but children is really observing them.
Okay, so we're talking any infection has the possibility to lead to sepsis. So it's not okay. Well, if it's a wound infection, or if it's an infection of the urinary tract, if it's an infection of the lungs, that is not going to lead. No, any infection of any part of the body could lead to sepsis if we're not we don't take the necessary precautions. Yes.
And one of the things you said, and that brings me to ask you this question. You mentioned sepsis, and you also mentioned the case where the person went into septic shock. So in terms of the stages or the description generally of the stage of sepsis, if you can give us a bit more information about that.
Yeah, so when you have sepsis, there are different stages. Although right now, the last literature I read on, they're trying to do away with the in-between stages. So you can go from just having sepsis to septic shock. So initially you would have the sepsis. It is not that bad, but as it's working its way more into your system, because everything is happening at the same time, and you have all kind of chemicals being released in your body and causing, for example, your large blood vessels to dilate, they become bigger. Then you have the smaller ones, the capillaries may leak fluid into your tissue, so you might have some swelling. So while that is happening, your liver is being affected, you will develop blood clots. That is why COVID was a typical case of sepsis, because mostly everybody came in with respiratory problem. They had clotting problems. They were confused. They were everything. So COVID-19, a typical case of sepsis. So you can have sepsis where it is not too bad, but it's working its way, and all of a sudden your blood pressure plummets to less than the systolic, which is the first number, to less than 100. Your respirations go up to greater than 22. Then you start having temperature or no temperature. With sepsis, you can have fever or no fever, because this is a long, if you have to talk about the physiology of sepsis, it's quite long. But you could have a warm stage, which is still good enough, and then you will have the cold stage where your skin becomes mottled, changes color, and you'll see it better in a light-skinned person compared to dark people like us. So once you see that, you know already the person is not being perfused properly. So you really have to step up the plate and treat quickly.
Okay. And when we talk about treatment, what are we talking about for sepsis? So you have a patient, and that is the suspected diagnosis. What happens for that patient in terms of treatment?
So you would have to start off with broad spectrum antibiotic.
Okay.
IV fluids, and then if the blood pressure is really low, what we call vasopressors, anything to keep your blood pressure up.
Okay.
And this is why it is very important when a person comes into hospital, you do a set of blood cultures. I know in our setting, resources are not there and whatever, but then you still want to isolate the organism. Because initially you start broad, but then you need to narrow it down. And I'm saying it's simple because at my hospital, I'm in 1, 2, 3. From the emergency room, they would have already started. They would do all the necessary bloods, and they send the patient to my unit. Because you cannot I shouldn't say cannot, but when you start vasopressors, you need to be in a monitored area, because they have their issues as well. And you can start from one and then goes into a more potent one. So you need the person to be on monitors.
Okay. So you start with the broad spectrum antibiotics, but it's important to identify the causative agent of the infection,
Right.
so that you can be a little more specific if you need to in terms of the treatment,
Right.
the treatment
Right.
course. Right. Okay.
And that would be in the case of a suspected bacterial infection. Yes.
Yes.
Mhm.
Okay.
Mhm. Now, oftentimes when we hear about sepsis, or when I've heard about sepsis, it's hospital-induced infections, or people talk about
Hospital-acquired.
hospital-acquired infections. People talk a lot about the risks associated with, of course, getting an infection after a surgical procedure whilst hospitalized. So let us know a bit of background about that, the hospital cases of sepsis, or how can sepsis occur within the hospital setting. So you didn't come in septic, but during the course of the hospital stay, that happens. How does that
develop sepsis? Okay, so 80% of sepsis is from the community.
Okay.
Only 20%
From the
according
hospital.
to the data. Yes.
From hospital.
From hospital.
And it's so interesting because when I've read about it in the past, it's like the hospital part is so,
It's only 20%. And look,
okay, so 20% hospital, okay.
yeah, and 80% from the community already.
Okay.
You have sepsis. So in hospital, like if you had a wound, a surgical intervention, again, I don't work on surgery, so this patient will not really actually come to us.
All right.
However, how that can happen, not washing your hands properly,
okay,
and just go in and open the wound. Sometimes it could just be poor technique. Sometimes the person might have some infection already that causes the wound itself to not be healing, especially with diabetes.
Okay.
Yeah. But more often, surgical clean wound, there shouldn't be any problem. But if it becomes infected for whatever reason, then you could develop sepsis.
Okay.
And that's where the 20% comes in. So 80% is really from the community.
And you mentioned that, and it's interesting because, like you say, we feel like it might be the other way around. But a lot of times when you're in the hospital setting, you're in a sterile environment when you do your surgery, so you really have the best measures out there in terms of keeping your wound and, while you're open, keeping your insides protected. Now, when you go onto the wards, you have other sick persons there with you, persons who may have also done surgery. If you did a surgery, you'd be on the surgical ward. And then there's different things. So, for instance, you might not have an infection. Your next door neighbor might have had some form of infection. You might be using the same washroom. You might be using the same sinks, all of those things. And then if you don't clean properly or they don't clean properly, all these things can factor into, spreading the infection. And then a lot of times we tend to pick at ourselves. So you might have a surgery and, it hurts. You want to see it. You want to show it to your mother when she reads. You want to, lift up the gauze, look at it, how it changes, how it looks. And then all of these things is putting it, out there in the open for risk of developing infection. So a lot of things we do and a lot of habits that we have is what keeps us at risk. And mentioned in the hospital, something else I want to say, because a lot of times we get a lot of patients who come in and they'll tell us, boy, I have that issue, but I'm not going to hospital because it's there people get sick and it's there people get infections. So now you see in the data, you're more likely to get these deadly infections or even septic outside of the hospital setting. Yeah. And if it is that you have an infection, you have a wound, you have an issue, the risk of it developing worse into a worse issue at home is always greater. So it's better that we take out the fear of the hospital in our brains.
Yes.
Go to the hospital and get it treated. You may acquire an infection 20%. As opposed to staying at home and then you lose a leg, it has to be amputated, you develop gangrene, something, So we need to take out that mentality in our brains and take ourselves to the necessary clinics and hospitals if we do have an issue.
So the importance of treatment, yes.
Cross-infection, as we talk about, this is why it is just so important and we cannot stress enough wash your hands. Wash your hands before you attend to the patient. And I'm saying that for the medical personnel. Wash your hands before you enter the room. Wash your hands after you attend to the patient. Constantly washing your hands, because that is one of the ways that infection is spread at the hospital. And for example, a person is in an isolation room. You come out, you probably gone in to go into the room, you remove the gloves. And because you had on gloves, you say, oh, I had gloves. No, you still have to wash your hands. Hand washing at least for 20 seconds. Very, very, very important. And we cannot stress enough about hand washing.
Hand washing and hand hygiene.
Yes.
So important. And sometimes things that we learned in emergency or settings such as the COVID-19 pandemic, everybody was talking about hand hygiene and hand washing. Sometimes we kind of forget about these things, but they apply to regular times as well. So they apply for just general healthy outcomes. So it's not just in peak season of infection, like a pandemic or like peak flu season or something like that. We need to keep at it with reinforcing the importance of things like proper hand washing or hand hygiene, as we like to say. Yes.
And even PPEs too. So that's the personal protective equipment. So for instance, right now, you mentioned after COVID, and that's funny that you said that, because before COVID, if I saw someone with a mask, it would be like, what's going on?
Yes.
But now people still do use their mask. And for us in the pharmacy, if one of us gets sick, we'll be like, okay, so wear your mask, because we're working and you're trying not to spread that infection to your coworkers. So it's important that we remember the importance, like Trudy said, of those things that we have available to us to keep this spread of infection, bacteria, disease.
Yeah, keep it at bay.
Right.
And so not just important for the medical professionals, of course, but just important for the general population. Yes. I wanted you to guide us a bit. I am very intrigued by what you said initially as it relates to the progression of sepsis and it possibly being very quick. 4 to 12 hours, you said, and somebody might lose their life, right? So I want to maybe get from you a progression, worst case scenario of somebody with an infection who has developed sepsis. What happens to their bodies to allow them to possibly die in 4 to 12 hours? Because that's a quick time, and I've heard of organ failure or multiple organ failure. So I want to know what happens to get somebody to that stage.
So when you develop sepsis, unfortunately, the organs that are targeted are the larger and important organs.
Okay.
Your lungs, your kidneys, your heart.
Okay.
So, I mean, if you get severe sepsis because it has progressed so quickly, your lungs being affected, then because it has progressed, your saturation starts going down.
Your oxygen
saturation.
Okay.
So which means that your other organs are not being perfused, they're not getting oxygen.
Okay.
So as a result of that, what is going on in your body now, the tissues haven't got enough oxygen, so it's now working on what we call anaerobic metabolism without oxygen. So because of that, now you end up going into an acidotic state, primarily metabolic acidosis.
Okay.
And the more acidic your body is the chances of dying increasing. So once your pH level starts going down less than 7.35, because we know the normal is 7.35 to 7.45.
Right.
Once you see that, you know already things are really going critical. Then your kidneys will shut down. Once your kidneys shut down, you know all the end products of all the bacteria and so there. Then you have to end up going on dialysis.
Okay.
So a person who goes into septic shock alone can eat up a ton of money in one shift. Because, in the ICU, for example, the person comes in, they have already triaged them in the emergency room. They start off already, but when they come to us now, our doctor is going to reassess then they may need their kidneys start shutting down. Somebody is going to do dialysis.
Mhm.
And what we do in our ICU is continuous dialysis, continuous veno-venous. Well, it's just a method that we use. So that's already a nurse you need for that, just to set up the machine, because it's going continuously and slowly. Then the person's blood pressure is probably plummeting. So you try one vasopressor, it's not working good, you add another one. So now, while you're working on this, somebody is working on the setting up the machine for the CVVH. You probably have the person may be still looking like they don't need to be intubated, but then you
never
have to
know.
start intubating. So in a split second, you could have a whole team of people there with just that one patient, because the sepsis is just going so quickly, and with the fact that it affects the major organs. So you're trying to preserve them,
Right.
and that is why you have to work really quickly.
Wow. That is, and you know, that cascade and how quickly it can happen is really alarming. And that is why I think a lot of people you know, speak about sepsis, even if they may not understand exactly what, but the whole concept of death and organ failure is often what is, you know, spoken about when people hear sepsis. Like, you know, this is going to lead to death, or somebody I knew was at the hospital and they said that they had sepsis and then they just died. You know, so you often hear that sort of recall of people when it comes to sepsis, that immediacy of death, or of a very negative outcome.
Yes. For example, if the appendix ruptures, um, Jake on CNN, I think a couple years ago, his daughter's appendix ruptured, and he took her there. They sent her home. Well, long story short, in the end, I guess because of who he is, you know, he ended up calling some big boy, and they finally did a sonogram or something for her, and they saw that she was in bad shape. They took her in, and when she gives her journey, it is really, really, really pathetic. But at least she's doing well now. So, and for our World Sepsis Day, which was on the 13th of September, we had this outside program with Kyrie, and this young gentleman came. And, you know, we're just asking people whether they have heard the word sepsis. And he said, yeah. So I was kind of shocked. I said, really? He said, yes, because my appendix ruptured. So I said, okay, come, you know about sepsis, come get a prize.
Yes, yes, appendicitis and the possible rupture. That is a very no, I wouldn't say a very common case, but that's a case that people, I think, associate very well with sepsis. You know, the likelihood of the rupture of the appendix and what that means in terms of infection for them, and so I think that is a very good example that can make people connect the dots. I wanted to ask too, we spoke a bit about hospitals. I want to speak a bit to the possibility or the risk of sepsis for patients, or for people in long-term care facilities, elderly care facilities, people who may be susceptible to things like bed sores, and, you know, the likelihood of the infection arising from that, and that sort of scenario. So we did a little hospital overview, but what about facilities such as those?
So sepsis, as I said, affects everyone, and especially if you're older or younger, and all in between, all the people who have immunocompromised conditions, like people who have cancer, HIV, diabetes, and so forth. So oftentimes you'll find people who are in nursing home, they're in the elderly bracket, so they would be more susceptible. Then another thing, if their diet is not very good, their skin, integrity is not good, and then If they are not very mobile, here comes the bed sores. Then if you don't have, people to really push them out, taking care of them, so then the bed sore, they develop the bed sore, then the bed sore gets infected, and the chances are they'll end up with sepsis. If they don't get sepsis, another thing is that older people are so much more susceptible to urinary tract infection.
Indeed.
And by the time you know it, they become confused. This is what brings a lot of them into the hospital, because at the nursing home they would say, but so and so, how she's so sleepy and whatever, because now the organism is in her system, and when they come, you find the urine is so dirty. Urinary tract infection. That's one of the common causes for nursing home.
Okay.
And you mentioned nursing homes. A lot of times with elderly persons, we have a lot of people now who are using catheters, and that is also another huge site
Source of
for the
infection.
possibility of infection. So most persons who have catheters, they do get regular antibiotics for prophylaxis or prevention measures. But sometimes if you don't take it on time, if you're unable to move and maybe you don't get your meds given to you on time, if the medication itself is not if the bacteria that's there at any given point, the medication, it's not susceptible to that medication. So all of these things can bring about the worsening of those urinary infections that can do so much damage, And a lot of times we get people, I would say, coming into the pharmacy, they have the symptoms, and you might not have symptoms and you might have a urinary tract infection, and that's the scary part. But they come in with the burning, or they'll tell you, I'm peeing a lot, I'm getting up many times in the night to pee, and they come in with that and they tell you, can I get a tablet for it? And you try to tell them the importance of really getting to your doctor, because you're going to need antibiotics for that infection. And sometimes they'll pick up the ones on the floor that help with the symptoms. Now, these drugs like the urinary pain relief, the phenazopridine, it might help with the symptoms. And when you take it, you think you're clear and free. And you never follow up, you never get any more burning, but then you have that infection festering that goes from that tract up to the bladder, up to the kidneys, and then at the kidneys point can actually do long-term damage and scarring. So it's worth talking about the UTIs, because that's a big one.
Definitely. Let me just open up our lines. We've been talking with Nurse Marlene Lambert, Greenaway Lambert, for the people who maybe know her from her maiden name. And she's been bringing awareness to us on this platform of sepsis. And I just want to give our audience a chance, if they'd like to interact with her this morning here on the program, to call. Our numbers are 449-3095, 449-3096, 449-3097, and 616-4257. Of course, if you're overseas and you'd like to make a contribution or interact with our guest here, the number is 305-432-9624. So we're opening up the lines at this time. If you'd like to call in, now is your time. And of course, we do have extra time this morning because we started late. And so for the people who are used to us ending at 11:30, we are going on a bit past that because of the delayed start to the program this morning. So we have a bit of time with you. So don't panic too much. All right, we have a bit of time with you. But yes, it's such an interesting discussion that we are having here, because there's so many pathways that can lead to sepsis.
Yes.
So it's a conversation that is so broad, because we're talking about infections and the number of types of infections and scenarios of infections that we have brought up here on the program. And of course, I know we haven't touched on a quarter of what is possible. And it's already so broad. So I can imagine how necessary it is for people to be aware about sepsis and the possibility, and how to prevent that occurrence.
One of the questions I had for you, Nurse, is, do you have some statistics that you can give us in terms of sepsis? Because oftentimes, if it's something that we have not heard before, and a lot of us probably have not heard sepsis, we tend to put it aside because we think it's not prevalent. So maybe you can give us some of those statistics so we can, know how serious that sepsis is.
So let me start with Dominica. I don't have any information or any data on that, but that doesn't mean that no one died of sepsis, because at least my father died of sepsis, and it was on his death certificate. So let's start with him. Then I know there are a number of other people, but I don't know what was put on their death certificate. But just because of what I was told, not heard, told. I would
Yeah, the
think it's
anecdotal
sepsis.
evidence. Yeah.
So, however, in 2017, the World Health Organization, the data that they provided us with is 47 to 50 million cases per year, and that is globally, and at least 11 million deaths per year.
Wow.
1 in 5 deaths worldwide is associated with sepsis. Sepsis is the number 1 cause of death in hospitals. Sepsis is the number 1 cause for hospital readmissions.
Okay.
And of course, sepsis is the number 1 cause for healthcare costs. Up to 50% of sepsis survivors suffer from long-term physical and or psychological effects.
Okay.
40% of cases are children under 5.
That's a big percentage
Big
there.
number, yeah.
80% of sepsis cases occur outside of the hospital. That's why I said 20% occurs in the hospital. Sepsis is always caused by an infection, and they give like pneumonia or diarrheal illnesses. Sepsis is a medical emergency. So if you or someone you know shows sign of sepsis, seek medical care immediately. Every hour counts.
So these are some alarming statistics. I mean, when you look at 1 in 5 deaths are caused by sepsis, so that's 20% of deaths are due to sepsis. That is a pretty big percentage. Yes. 20% of deaths. And then that statistic of it's the leading cause of hospital deaths. So, people working locally in the hospital. I mean, a nurse has said to me, she hates to hear on the death announcements, so and so died at this hospital, Dominica China French, because it sounds like hospital just means death.
Right.
And so it just gives that overall impression, even if it's where the person died for real, but it just makes it seem that the hospital is just the cause of the death. But we're saying here that sepsis is responsible for, or the leading responsible cause of deaths at the hospital. So that is an important one for sure.
I think one way to look at it, and you're right, because I hear that a lot, but one way to look at it is you won't go to the hospital if you are fine.
Right.
So you expect that you hear, most of the deaths you hear on island might be at the hospital, because at that point you had an issue and you went to the hospital. So that is the way we need to start looking at healthcare. That is the way we need to start looking at it. And of course, the awareness, sepsis awareness will help in terms of you knowing what to look for or what to ask your doctor, as well as healthcare providers knowing, what they might be adding into their triaging. Now, one of the things also I wanted to point out, sepsis, I think if we look at it as a separate thing, then it seems like the numbers are unimaginable. But when you look at it as sepsis is not something on its own, like, okay, you think of high blood pressure and that's high blood pressure. Sepsis comes along with something else, right?
Yeah.
So one person may have died of myocardial infarction. One person, you will see, they may have died of organ failure. But what caused the organ failure? What was behind the conditions that led to a myocardial infarction? So that person might have had some form of heart failure because they developed sepsis because of a related or unrelated condition, and so the heart gave up. So the end result is the heart gave up, but they had sepsis. You understand? So
Yes.
I think that's why the numbers are so huge.
Mhm.
And if we look at it that way, then we understand the vast importance in knowing what sepsis is and the vast importance in not ignoring. Sometimes you just tell yourself, I'm not feeling 100. You maybe have chills, you get a fever off and on, but you just figure it's fine, it stops, or you figure you're okay. So these are the important things that you have to think of for you to truly understand the depth that sepsis goes.
So this young man, Rory, Rory Staunton, Staunton. I like to use him. 12 years old, playing basketball. So when he jumped for the ball, he fell down, got a little scrape on his hand, just a little bruise. I cannot remember the sequence of the days, but in the night he wasn't. In passing, according to what was documented, in passing, he mentioned it to his family. Oh yeah, when I fell down, the coach just cleaned it and put a little band-aid. Later on, as per his mother, he said he's not feeling well around midnight. Okay, no problem. In the morning, took him to a hospital, big time hospital in New York. They said, oh, it's a flu, a bug that's running. Give him some Tylenol. We use Tylenol in the States. Here is paracetamol, I think. Okay. And, he looked a little dehydrated, gave him some fluid, sent him home. Long story short, I think it happened on a Wednesday. By the following Tuesday or something, so he was dead. We're just going back and forth, and no one was checking him for sepsis. But unfortunate thing about it, they did the lab tests and everything, but they still figured out it's just a little bug. Sent him home, and they had the results, which could lead them that something was really wrong with the young man. So since then, it is mandatory now in the US, especially in New York, you triage people for sepsis and you discuss their lab values, especially with regards to children. You discuss the lab values with the parents.
Wow.
It is a law.
Okay,
It's a
arising
law.
out of that case?
Yeah,
Or,
as
okay.
a result of that.
Okay.
Rory Staunton.
Okay.
Yeah, as a result of that.
That seems simple,
Because,
though.
what happened, you could do a blood test too. There are no specific tests for sepsis, but the clinical assessment, and if you do a complete blood count, the WBC, the white blood cells, will be elevated.
Okay.
That
Fighting.
will lead you to something. Then if you do other tests, like here I know we probably wouldn't be able to do it, although it would be nice to do it, an arterial blood gas, where you go the lactate, if it is elevated more than 4, because lactate is actually when the organ have lost all its oxygen
and
So
it's
you're doing
So,
anaerobic.
anaerobic, yeah. So we would have a fair idea that your organs are not being perfused if your lactate level is greater than 4.
Okay.
So that can already lead you into knowing that something is wrong. They did all the tests and everything, but they didn't. No
take the
one had
results.
looked at it while they were still there. They sent
Okay.
them home,
Okay.
and then he started getting worse and worse and worse.
Okay.
I know here the ESR is done as well to note any inflammation. How critical you think it might be?
Well, we don't use the ESR as a determining factor for sepsis. No.
Okay. So I wanted to go into a bit, of course, as it relates to prevention of infections. I mean, we've spoken about the fact that sepsis arises because of an infection, and we've spoken about the possible outcome of sepsis. We've spoken about treatment. You did speak a bit earlier about treatment as it related to broad spectrum antibiotic use, IV fluid administration, and so on if somebody has sepsis. But now I want to go into a bit basic infection control methods that we can possibly use, of course, and what is available on the pharmacy side for basic infection control. Because what we're hearing here is that any infection
Yes.
has the possibility or the probability of leading to sepsis. So how do we manage or how do we control infections, and what are some, I guess I would say, tips from the pharmacist's perspective about infection control? Leona, let us know what we can be looking out for.
Okay, well, like we said, it's so broad, but infection control, at least the ones we can clearly see. So I'll start off with talking about the most visible forms of possible infections, and that would be wounds. So if you have a wound, you fell, you bruised yourself, you developed, maybe you had a mosquito bite, you itch it. From the time your skin is broken, it's worth keeping clean. It can be the smallest thing. You do a needle prick, you check your blood glucose. That's why we use the alcohol wipes when we do that before and after. Because once you puncture the skin, your inner bits are now exposed to the outside. And the skin, persons often think of the skin as your beauty aesthetic, but the skin is literally a barrier. That is your biggest
Biggest one, yes.
protection,
Yes.
right? It's literally your biggest organ, and it's your biggest protection outside of the outside factors of the world. And that's why we're not sick all the time. So if you have any punctures in the skin, any wound, any burns, you have to take the necessary measures to keep that clean. So some of our products for the week are exactly that. They are products that deal in disinfecting and sterilizing, so antiseptics. So we have 3 of them on there. There's the saline wound wash, and that one, well, most gentle, less likely to irritate. It really is saline, so it would be sodium chloride or basic some salt water
Salt,
in a specific percentage. So you can get that in the wound wash can, and it's a pressurized can, so you can spray it onto the wound. So if you have a small wound to a generally larger wound, you spray it on, and that will apply the saline water onto the wound. That will help to disinfect the wound. Now, we're not talking about when we start to see pus or anything of the sort. As soon as you get the wound, your focus is keeping it clean. So that is preventative measures. We also have the chlorhexidine 4%, and that's something that you dilute with water to keep bacteria out of these wounds and to keep from getting any infections. A lot of times you might find that using, even in children, that they will tell you, you put, if it's 1 part of this and 4 parts of water, and you dilute that water, and you can use it almost like a solution to wash the skin, to keep dirt, any bacteria, because our skin is full of bacteria, by the way. So there's bacteria everywhere. There's parasites in the soil. There's everything is all around us, and the skin just acts as a barrier. So right now, if I was to take a microscope and take a little sample on top of your skin, you would probably be a germaphobe afterwards because you would see a lot of different, bacteria and a lot of different, in that one culture. So really, when you have the open wound, things like the chlorhexidine will act as a wash to keep bacteria out of that wound or from festering.
So what's the difference between that and the saline solution? Is it interchangeable, the use?
Well, typically sometimes. Now, some people may have some allergy to say the chlorhexidine, which is why it needs to be diluted. It's not supposed to be given in its potent form. So if it is that it irritates your skin, an allergy is really a person by person basis. If it is that it irritates your skin, then we'd probably give you something else like the saline, which is much gentler. If it's a very, very young individual, we can do the chlorhexidine diluted, but saline again would be a safer option, essentially. So the third thing we have on there is something that we should all know and should all have in our medicine cabinets at home. And that's actually what's used to sterilize in surgeries. And that's the povidone iodine, or you'll hear betadine. And it can be used for that. So a lot of times, even minor surgeries in the doctor's office, they would swab the area with betadine, and it looks kind of like a brown staining, right? So they'll swab the area they're going to cut, and they'll also swab around that area, so to keep that portion of the skin sterilized. So that's something that you can buy at the pharmacy and have at home. So if it is that you get a cut, you get a bruise, a burn, a wound, whatever broken skin you have, you use that. If you use a cotton pad and you clean the area around it, and of course you can clean the actual wound with it as well. You can get those in the little packets too. So those are convenient, especially if you get a wound on the go. I cannot tell you how many wounds, paper cuts, whatever it is I get on the job. So you have that to just clean out the wound and go along your day. Depending on what type of wound it is, you might put a little antibiotic ointment on it. Depending on what type of wound, it needs to stay uncovered. So most times if you get a burn, if it's like a 3rd-degree burn, you should really be in the hospital.
Yeah.
And I know a lot of persons who get burns, particularly on bikes, because when you skid on the road, that is a friction burn you get there, and they'll just go home, and they figure that is the life of riding a bike. I had someone who came into the store recently, and he was at home, and he sent someone to buy exactly what he wanted, but then what he was going to buy might not have been the best fit, and sometimes we just ignore these things because we figure we're getting burns all the time and they'll heal. But depending on where you fall, you don't know, you fell in some dirt, if you fell on that portion of the road somewhere, you don't know what's in the soil, what might be there to cause further infection. So really you need to get the proper agents to clean out those wounds. And if the wound is deep, you're having a lot of bleeding, then you should probably check with the hospital or with the health centers about it. But any one of those solutions can be used to clean out the wound. And of course, when you get to the OTC shelf, there's also many other first aid things that can aid in that. So if you can get some antibiotic ointments. We have those that come with pain relief as well. If it's really painful, you can also get, if it's a wound that needs to be covered, you can get your transparent dressings, your hydrocolloid dressings that kind of helps with those wounds that kind of drain a bit. So a lot of times if you have a wound that oozes a lot, it's not that it might not be infected, but there's a lot of like perfusion. So you get a lot of liquid coming out from there. Then you can get those hydrocolloid dressings that kind of soak it up and keep the liquid out of the wound and out of seeping out everywhere and mixing with the rest of your body. But these are the items that are available. So that is for prevention of, infection for open wounds. Now, we have other times where we don't feel okay. And we might come in or you might be at work. If you have a fever, I will say to anybody, do not ignore it. It's not random. Something is happening. Now, a fever is not necessarily a bad thing. Because with a fever, even with treating a fever, when you have a fever, your body, it's a signal that your body is fighting.
Your immune system,
your immune system
response
is working. So it's fighting either a virus, a bacteria, whatever it may be, it's fighting something. But if you're having a fever and it lasts for many days, right, you may have other symptoms. So sometimes you have flu-like symptoms and you have a fever and you can probably say maybe that's the flu, but it's still worth assessing. And then other times you just have a random fever that you built up. Your body hits. You don't know what's causing the fever. You don't have any flu. You don't have any noticeable infection that you know of. It's worth getting checked out. Now, let's say you go to the doctor and they realize, you have XYZ infection and they put you on, if it's bacterial, they put you on some antibiotics. If it's viral, they put you on some antivirals. At that point, I cannot stress enough of how important it is to take those medicines on time, as given, and most importantly, for the length of time given. Right? It's funny we have this today because we've been preparing for sepsis, right? So I've been doing my research on sepsis and everything. And then yesterday, somebody came to the pharmacy and they came with 2 different types of antibiotics. And I think that's where sometimes in the healthcare system, consultation is very important. So sometimes you get drugs, and do not be afraid of your doctors or your nurses. You go in because you're sick. You get 2 antibiotics. And when you get them, you don't ask anything, or you might not think anything by it. You're too afraid to ask the doctor. And then you come to the pharmacy, you buy it anyway, and you go home and maybe you don't take it. Maybe you take it on time. Maybe you don't take it on time. Maybe you feel better in 2 days and you stop, but it's for 7 days. When you come to the pharmacy, so somebody came to the pharmacy with an extension. So they were getting an extra 5 days in one, an extra 3 days in one. And in talking to them, what I noticed is that she thought that it was too much medication because she figured, why do I have 2 antibiotics? So you will only take in 1. But sometimes with different infections, you have to be on sometimes 2, on sometimes 3 different types of antibiotics to clear that particular infection. Now, we have to trust that our doctors know their stuff, and that's what they, that's the field that they're in, right? So they know more about these things than we do. We trust enough to go to them and get the prescription and buy the medication. So at this point, we have to trust enough that the direction that's given is what we need, right? So if you're given multiple drugs and you're ever feeling shaky about it, talk to your doctor right then and there. As they're writing the prescription, you can ask them what the medication is for. When you come into the pharmacy to buy the medication, you can ask us why. If you were afraid and you want to know, you can ask us, why do I have these two things? You can tell us you don't want to take it, and we'll explain to you. I rather, you come in and you tell me, I'm not taking this one. I feel this is too much, and I will tell you exactly, this is what it is. So you get a better idea, because what happens is, if we take those meds, or we don't take both of them, we don't take them on time, we feel better in 2 days and we stop, it gives the infection time to fester. It gives the infection time to grow, and then you start feeling bad again. And maybe you don't tell your doctor, well, I didn't take it properly. They give you extra of this med, but then your infection might be resistant at that point. So you might need a whole different medication altogether. And that comes into added costs with those things. So instead of doing one doctor's visit and one purchase of medication, you had to go back to the doctor, you had to purchase more medication. It still didn't work. The infection got worse, you got sick, and then you're at risk of developing things like sepsis. And that's where it starts. So if you are able to identify these things, it's important that we adhere to our medication regimens for the best possible outcome.
Thank you, Leona. Definitely, pharmacists would advocate for proper antibiotic use. I know a lot of us abuse antibiotics. She gave this scenario where the person is not using it properly, but a lot of people abuse antibiotics, of course, leading to antibiotic resistant strains of bacteria, and that's what we don't want. So proper use of your antibiotics, use according to prescription, use according to the directions that you are given, and not sharing antibiotics as well, or giving people your antibiotic prescription that you did not use all of for their possible infection. So please don't do that, and let's try to ward off infections in the right way, and don't perform that critical sin of antibiotic misuse. I know medical professionals hate, as we say in our local parlance, they hate to see you come in with your bad practices as it relates to antibiotics. They just hate to see you come in. So let us all work together to ensure that we have a healthier and more productive health outcomes when we have infections or suspected infections. Nurse Lambert,
Yes.
it is the end of our time here on the program. We did get some extra time, but it is the end now of our time. So I want to give you the opportunity to give your closing remarks. You've been a wonderful guest with us here on the program this morning, and I think you have given a lot of critical information as it relates to sepsis. So I'm giving you the opportunity to give your closing remarks on the topic as we wind down here on Health Vibes this morning.
Thank you. So sepsis is as a result of an infection. It's the response. It is overwhelming. It can cause tissue damage, organ failure, and leads to death. No one is exempted from developing sepsis. Sepsis should be regarded as an emergency. And the same way you would run to the emergency room if you were if you were developing a stroke or myocardial infarct, then sepsis requires that type of emergency. So I will just end by saying that sepsis is time. The T is temperature, fever or no fever. I, of course, is the infection. You must have an infection to develop sepsis. Mental decline, confused, unable to be aroused, and extremely ill, because the person might say, I feel like dying, an adult, right? I feel like dying. Take that person seriously Sometimes people exaggerate a little, any little thing, more. But in this case, take it seriously. Anytime someone says, I feel like dying, because you just never know what's happening. So, and just know that 80% of sepsis develops or is acquired in the community, only 20%. So have no fear when you go to the hospital. And all I'm asking people is to just pay particular attention to hand hygiene, because you cannot prevent sepsis, but you can prevent being infected with infection. So hand hygiene, vaccination, especially for children. I know here we're not big on adults getting flu vaccine and this and that and the other, but at least, make sure your children get the vaccine and hand hygiene and walking without shoes. Try to avoid that, because we can get sepsis through the parasites as well. Leptospirosis, I know we had a number of cases. Unfortunately, some people died. And but it can also lead to sepsis. So when you go out in your garden, wear shoes.
So good advice there, and I hope people, have listened intently. I and have, really registered the information. Of course, it was a pleasure to have you on the program. We thank you so much for agreeing to be on the program with us this morning, and of course, giving your very valuable experience and information relating to sepsis awareness. The first time I had seen you is on Sepsis Awareness Day, doing the event at All Saints.
So this year,
Yes, this
for World
year,
Sepsis Day.
right? And
Okay.
it struck me, hey, we should have covered this in September, but we're here in October. And
Sepsis is every day.
yes, we're here in October, still, bringing awareness. I know our listeners. I see them, thanking Eunice for the information that you've brought forward. So we want to thank them for always tuning in to the program and lending a listening ear on Health Vibes. Leona, I don't know what is up, anything up with Jollies this week, but I do want to wish pharmacists and the Jollies team a great week. I forgot to say that at the start of the show, so I'll say it at the end. And of course, to all our listeners, we hope, God willing, we'll be on with you again next week for another episode of Health Vibe. So until then, do take care and have a great week. We'll see you again soon. Bye-bye.
This pharmacy is bringing vibes to health with Health Vibes. Health Vibes. Each and every Wednesday from 10 to 11.